Okay, thank you for inviting me. My name is Saidi Kapiga from Tanzania. So I'm going to present some of the data on the current status of treatment and care programs in East Africa. And I have been in contact with some of my colleagues in other countries in East Africa and some data, but I also know some people here who may be able to fill up some of the gaps which I may not have covered here. These are the recent data from the UNAIDS report. 7.6 million people receiving these drugs in Africa, almost all of these in sub-Saharan Africa, 7.5. The countries in East Africa, which I'm going to focus, most of them have between 2,500 to 250,000 to million numbers of cases, except for some of the smaller countries like Rwanda and Burundi. So there is a huge number of people who are already in these drugs in this region. These are the estimates of prevalence based on national surveys which were recently done in these countries. So it's a huge epidemic. Obviously, it's not uniform in these countries, ranging from 1.3 to about 7.2. Again, from the recent DHS surveys. The coverage based on the information I got from the WHO website, again, is variable, ranging from 58% to about 87%. These are all based on the 2010 WHO guidelines as of end of 2012. We can also look at the coverage for PMTCT in these countries, again, from the WHO database, from about 24 in Ethiopia to about 74 in Tanzania. So overall, quite large proportion of people who need to get these drugs who are receiving them. Now, the guidelines are changed. As you all know, we have now new guidelines based on the WHO 2013 guidelines, where the new target is about 21.2 million in Africa. And based on these new guidelines, the overall coverage is a bit low, about 36%. So obviously, for these countries, they have to redefine put in place new efforts to attain these targets. I know there are some of the countries where they are still discussing whether these new guidelines and these new targets are realistic in view of other things. But these new targets are consistent with some of other global sort of targets, like the UNAIDS Treatment 2015 initiative, aiming to reach 15 million people on these drugs by 2015, so within about 1 year and a half or so. So the goalposts have changed, and the coverage which we have seen will need to be revised in view of those changes. But overall, if you use these new guidelines, we have a huge gap in all the regions in Africa. These figures from the UNAIDS report, 59% gap in terms of people we need to treat in Eastern and Southern Africa, 89% in North Africa, 79% in Western and Central Africa. But if you look at the overall global picture, it's about 66%. So really, these new guidelines are exciting, good targets based on evidence we have of the benefits of starting early the treatment, but it also means we have now to be thinking about much larger numbers which we need to reach in order to reduce that. So the next set of slides, I'm going to show you some trends in selected countries where I was able to get the data just to show you that actually over several years, we have been doing well in terms of increasing numbers of patients and other indicators. So this is an example from Kenya. Overall, this line here showing the overall trend, numbers of people since 2009, overall increasing trend, about 1,171 health facilities now providing these drugs, slightly more than 400,000 patients on these life-saving drugs. The coverage is a little bit higher in adults than in children, but overall, an upward trend which is consistent with rapid scale-up of services. This is another example from Tanzania, 825 health facilities, more than 380,000 people on treatment, which is consistent with 61% coverage. Again, relatively higher coverage in adults than children, and overall high trends, increasing trends of use, and although there are some projections here for the next 2 years or so. And then another example from Uganda, again, similar trend, 1,478 health facilities providing 570,000 patients, relatively higher coverage in adults than in children. So overall, in all the countries in the region, and these are the 3 countries where I was able to access the data, there is clear evidence that we are getting more and more people on treatment, which is obviously very good news. Now, apart from increasing number of people in the programs, there is also changing characteristics of people who are coming in these. This is one of the study which I'm just using as to illustrate what is happening. Overall, there is increasing numbers, but it seems we are increasingly seeing people at an earlier stage than it used to be. In this study, the median CD4 count have increased significantly from about 87 to 185 between 2002 and 2008 and 9. So the programs are increasingly reaching people at slightly relatively earlier age. But also the regimens are changing. There is more use of less toxic regimens over time. And most people or most patients now are receiving the services in the facilities which are essentially closer to where they are. And self-payments or payment for the essential services is almost disappeared. So a lot of people accessing services as part of the public facilities without need to pay. But there are also areas where things are not working very well. One of these areas of population is the coverage in general in all these countries is relatively lower in children and adolescents. And in all these countries, you have less than 25% of children eligible who are covered based on the current guidelines. So this is a major area where more work is needed. We are also not doing very well in reaching men. In all the countries, we have more women in the program than men, and men usually tend to come a little bit later than women. And a couple of studies have, one of the possible explanation have been that maybe because we have PMTCT and other programs which may be giving benefit to women, but there is no evidence that the PMTCT benefit may be completely explaining these differences we see in coverage between men and women. There are also, I think, a couple of other speakers have talked about key populations, which we are we are not doing very well in reaching those, as well as populations in some of the remote rural communities where facilities may be limited, lack of trained staff, and so on. So even though there are positive signs, we are increasing numbers, but we still have these subpopulations where we need to do more. There are also other challenges which are facing or limiting the pace of scale up. And this is just a summary. I'm sure there are a lot of similarities which will be coming out from the other regions and also from many of your experiences in this room. Substantial proportion of people not knowing their status. I think it was raised here during the discussions. In Tanzania, for example, only 59% and 43% of men have ever been, women and men have ever been tested. And obviously, when you look further down, the proportion of those tested who actually have reached and they are receiving treatment is much lower. So the cascade of care is a problem. There's problems with linkage to care once you are treated, problems of personnel to provide the services. There are some issues with some of the services requiring that patients pay some fees, lab services, other services which may be limiting patients being able to access those services. Limited number of health facilities, although in most of these countries is increasing over time. But we have not reached a stage where all health facilities they are able to provide these services, and I think it should be one of our targets. Stockouts of drugs, not only drugs but also other supplies, lab test kits, and then we are getting a lot of people in treatment, but we are still losing quite a substantial number of people who come in, and by the end of the year or 6 months, they are lost in the system. So these overall, across the countries, these are the challenges which they are facing and which we need to think them. So in conclusion, overall, majority of patients eligible for ART based on the current guidelines are receiving treatment, although the level of coverage differs from one country to another. In all countries in the region, maybe with the exception of data which I saw from Tanzania, the ART coverage is relatively lower for PMTCT when compared to treatment. Additional efforts needed to reach increasing number of patients to reach the new targets and need to target groups where coverage is currently low. And then we need to address the known barriers to ART access. And lastly, I would like to acknowledge colleagues here who have helped me to get some of the data which I have shown here. Thank you very much.